One of the key components of our strategic plan for fiscal year 24 is to increase the number of and grow the current behavioral health services that we provide at CMH. With the increase in need for behavioral health services, we felt like it was important for us to make it a key component of our plan to grow those services, to continue the integrated approach, but also to provide new services that'll meet the needs of our communities. Across the United States, more than 60 million people are affected and live with mental health conditions. And Missouri ranks 41st in the nation in access to mental health services. It's an important part of CMH's responsibility to recruit new behavioral health providers to CMH. We're also seeing that need locally continue to grow. Approximately 60 patients a month come to our emergency department seeking help with their behavioral health condition. About 35% of those patients are pediatrics and don't have any other place to go for their care. This last year, we changed our leadership structure to include a behavioral health service line within our clinic system, but it goes beyond our clinic system, and it's an organizational look at behavioral health care, both inpatient and outpatient. I'm pleased that Dr. Rachel Swopes has accepted a role and is fulfilling that role now as the Clinical Director for Behavioral Health Services. And also Angela Long is the Administrative Lead and Operations Director for Behavioral Health Services at CMH.
So here at CMH, we have decided to put behavioral health, up front, foremost to the public and find out what we need to do for our community. So since I started at CMH, which has been quite a while, we had an inpatient service for our geriatric wellness population. We did have some providers available to the public, but currently, in the last few years, we are placing providers in every rural clinic that we can, school-based counselors in every possible school we can, and growing. I mean, opening up the transition clinic for that emergent need, we just continue to grow. So the transition clinic is a clinic that we will provide services for anyone 15 and over that have a behavioral health issue. So they may have been inpatient, gotten medications for 30 days upon discharge, and then have nowhere to go after that for 3 to 6 months because behavioral health is booked out for 3 to 6 months. So they enter this program. During this program, they will receive psychiatric care from a PMHMP that can either prescribe medications that are needed, or they will get psychology services and counseling. They will receive that counseling until they are put with a primary behavioral health provider. With the growth for CMH and behavioral health, we're running statistics, we're looking at areas of coverage and the need, what population of patient that we need to serve more in behavioral health. And within that service, I think we're going to see a lot of growth in the future. We do have, 2 grants that we're hoping for. We know that that's not something that we will for sure get, but we are trying to get some grants put in place. And we are looking at partnerships through other organizations in all areas, to be honest, in all the communities that we serve, just to provide better behavioral health. Those services, could include having behavioral health specialists on the police departments or within that community where we could be reached out instead of patients having to go to the ED. Providers are the biggest need. Having providers in the areas, in our surrounding areas and communities to be able to, get these patients in and seen with statistics showing that, behavioral health is so big and the need is so great, we need to provide that service for them.
I want to thank Angela and Dr. Swopes for their hard work at increasing and improving the behavioral health services at CMH. Also, I just want to thank our behavioral health providers for the compassion that they show to our patients, for the care that they demonstrate, and we've got a great core of a team, and I really see that growing as we move into the future.